Hello students, in this video we are going to see clavicle bone. It is one of the bone of pectoral girdle. It is also called as collar bone. So pectoral girdle is formed by clavicle and scapula. So this is one of the bone of pectoral girdle. It supports the shoulder here and it transmits the weight of the upper limb to the sternum like this. Weight is transmitted to the sternum from the upper limb. Now the parts, it is having two ends and shaft. Two ends are medial and lateral. So this is medial end and this is lateral end, and in between these two shaft is there. Lateral end, which is also called as acromial end, it is flattened. So this part, the red dotted line box, is the lateral end, which is flattened, and it has articular facet. This blue dot shows the articular facet for articulation with acromium, process of spine of scapula. That is why lateral end is also called as acromial end. So here in this photograph, the lateral end articulates with acromium. Now the medial end is also called as the sternal end. It is quadrangular in shape. So this medial end is rectangular in shape and it has articulation with sternum and first rib. So it has two impression, articular impression, one for sternum and one for rib. Now the shaft is divided into two parts: lateral 1/3 part of the shaft and medial 2/3 of part of the shaft. This division is based on the curvature. Medially there is larger curvature than the lateral one. So this is the superior view and inferior view of the clavicle, and this is the this division. This is the larger part is medial 2/3 and smaller part is lateral 1/3. Now the lateral 1/3 part of the shaft, it is flattened as I have already told you, and it has two borders, anterior border and posterior border. So this is superior and inferior view. So this red dotted line shows the anterior border and blue dotted line shows the posterior border. It has two surfaces, superior surface and inferior surface. So this is superior surface and this is inferior surface. In inferior surface there are two features. One is a tubercle known as conite tubercle. So oval elevation. This one is conite tubercle, and a ridge like structure known as trapezoid ridge here. Now the medial 2/3 of the shaft, on cut section it is near about round. So if we take cut section over here, it looks like round structure. It has four surfaces: anterior, posterior, superior, inferior. So this round structure, interiorly there is anterior surface, posteriorly there is posterior surface, superiorly there is superior surface, and inferiorly there is inferior surface. On inferior surface there are two features. One is round oval impression on the medial side. This is for articulation with first rib, and a longitudinal groove in the middle 1/3 of the clavicle inferior surface. This one is subclavian groove. Now the anatomical position and site determination. The lateral end is flat and medial end is large and quadrilateral. So this is superior view of clavicle, right clavicle, showing the medial and lateral end is flat and medial end is quadrilateral. So on the basis of which we can identify the medial and lateral side, and and shaft is slightly curved so that it is having the medial 2/3 part shows the convexity forward, and lateral 1/3 part shows the concavity forward. So this is medial 2/3 part has larger curve, and this is lateral 1/3 part shows the concavity, and on inferior surface there is longitudinal groove in the middle 1/3. As this is inferior view and this is a longitudinal groove, this is subclavian groove. So on this is on the basis of which we can identify superior and inferior side. So on the basis of these facts, this is a clavicle of right side. Now the attachments on clavicle, firstly at the lateral end. So lateral end there is a fibrous capsule of the acromioclavicular joint. So this green structure shows the capsule. Medial end also is having fibrous capsule for the sternoclavicular joint, this one. Then an articular disc in between sternum and medial end of clavicle, this is articular disc, and interclavicular ligament in between two clavicle. So this is interclavicular ligament. Now the lateral 1/3 of the shaft, on lateral 1/3 there is origin of deltoid on the anterior border. On posterior border there is attachment of insertion of trapezius. Then a ligament known as coracoclavicular ligament, which connects the coracoid process to the clavicle, which is having two parts. This one, on inferior surface it is attached to conite tubercle, this one, and trapezoid ridge, this one. Now the attachments on middle 2/3 part of shaft. So on the anterior surface there is attachment or origin of pectoralis major muscle. So this is origin of pectoralis major muscle. Then on superior surface there is origin of sternocleidomastoid muscle. This is sternocleidomastoid. And then this on inferior surface medial end costoclavicular ligament. So this is costoclavicular ligament. Then on subclavian groove there is insertion of subclavius muscle. This is subclavius muscle, insertion of subclavius muscle. Then on the medial and inferior surface there is origin of sternohyoid. This is origin of sternohyoid muscle. And then there is attachment of clavipectoral fascia around the borders of subclavius muscle. Now the ossifications. The clavicle is the first bone to start ossification, and it has membranocartilaginous ossification. The medial part develops from cartilage and lateral one develops from the membrane. It has two primary centers and one secondary centers. The two primary center for shaft like this appears at the age of 5th and 6th week of intrauterine life and fuses with other part on 45th day of life, and secondary center develops in medial end at the age of 15 to 17 years and fuses with the shaft in the age of 21 and 22 years. Now the applied aspect. It is the most common bone to be fractured in case of adult. So the most common site in the clavicle is junction between lateral 1/3 and medial 2/3. So this is the common site for clavicular fracture. Another applied aspect is cleidocranial dysostosis. It is a developmental defect that mostly affects the bones and teeth, and in this condition the clavicle is poorly developed or absent, and which allows the shoulder to be brought close together. So in this radiographic picture you can see there is absence of clavicle, and in this photograph we can see there is close approximation of shoulder anteriorly. So this is the case of cleidocranial dysostosis. Now the peculiarities of the clavicle. This is the only long bone which is present horizontally at the collar area, and it is the only long bone which is subcutaneous throughout its length. It is first bone to start ossification. It has two primary center of ossification. This is the only long bone which is having two primary centers for ossification. There is no medullary cavity in the clavicle, and occasionally it is pierced by middle supraclavicular nerves. So there are three supraclavicular nerves over the clavicle like this, and sometimes the middle supraclavicular nerve pierces clavicle, this one. Now the sex determination. In females, clavicle is shorter, lighter, thinner, smoother, and less curved than in males. And in females, the lateral end is little below than the medial end, and in case of male, the lateral end is either at the same level or slightly above than the medial end. So this is all about clavicle. Thank you.